Hi, I'm Joe Chili, mornings from 7 to 9 on Buffalo's oldie station, the Big Wack. Joining me on the Big Wack Buffalo on the Rise today is Dr. Christian Miliotto from Western New York Pain Relief. Doc, how you doing?
Good, how are you?
You're always in good shape. This is my go-to guy whenever I'm in pain. I call you quite frequently. No, I'm just kidding.
Every once in a while.
Let's talk about, one of the things that we're going to discuss is musculoskeletal issues. Now, even saying that's hard for me, understanding it is even worse. So what are we talking about here?
We're talking about everything attached to your body. Every bone, joint, ligament, muscle, tendon, the blood that controls that tissue. The people that have issues with joints in their body, neck and back pain, shoulder, hip, knee pain, these are things that over time create arthritis. Arthritis creates inflammation. Inflammation leads to pain, and then when left untreated, generally will start to affect the entirety of the body, radiating pain down the arms and legs, increased neck and back pain, loss of quality of life and function. The whole purpose of myself and my clinic and what we do is we want to help people heal from conditions that cannot be treated medically, which are basically, when you hurt yourself, for example, what do? You go see your primary, right?
Okay.
Well, realistically, what is your primary care physician going to do to treat your low back pain? There's really not much they can do. They can either refer you out for chiropractic or PT, refer you to maybe a neurosurgeon if he thinks you might need an injection or some prednisone, something to help with inflammation. But the truth of the matter is the condition itself, when properly assessed, is being managed, not treated. So the person is decaying over time, essentially, and they're having more and more problems. Our whole goal is to stop that. We don't want people to go through a revolving cycle. The patients that come into my clinic have been in pain for years and decades even, and have had multiple surgeries. And our goal is to help rehabilitate that tissue, use treatments that have no negative side effects with an actual healing to the tissue, and give you your life back.
What about something when you have, and I happen to have, I had knee pain recently because I had a meniscus problem, but even when not considering that, people that have pain in their knees regularly, and they say, we'll give you a shot of cortisone or whatever. I'm not a doctor, but I mean, say something like that. Is that artificially taking away the pain? Is that to relieve the inflammation? What does that actually do? So
that's one of the things I'm talking about with medication. Cortisone is an option, and it can provide temporary or even long-term benefits. But we have to understand what it is. When you're getting a corticosteroid injection or cortisone, there's a steroid in it and a numbing agent. So if we're sticking it in your back, sticking it in your hip, your shoulder, your knee, we are stopping your body's ability from making inflammation. We're numbing the area. If it takes, the person will get relief. But the problem with that is that steroid breaks down all of the soft and important tissues in that area. So everybody knows what cartilage is, okay? Knees are a serious problem. Well, why do most people end up getting knee replacements? They develop arthritis. The knee is an oddly shaped joint. One side wears down more than another. The muscles start to cause a problem, and the person's getting repeated corticosteroid injections. Eventually, that steroid is going to eat away the cartilage, damage the tissue more, and make the arthritis worse, which then leads to the actual knee replacement itself. Where, for example, in our office, we have a couple different treatments specifically for neck or back pain and nerve pain. But imagine being able to come in and do something called knee decompression. We can decompress your knee, just like I do decompression on my patients' necks or backs to help heal disc herniations or stenosis. Relieve the pressure on that joint, which will start to reduce the inflammation. And then use a class 4 medical laser, which can help to regrow cartilage in the area. So now we can actually help to reduce the knee damage, prolong any type of surgical intervention, and depending on the severity, we can get that knee to heal and help that person avoid surgery altogether.
Well, let me just ask you this. If you get an injection and it's relieving the pain, for instance, is there a chance that you can injure that more if you're not feeling the pain?
110%. So think about it like this, right? Earlier you and I were talking and you mentioned your knee pain that you had. You took a leave and a leave was effective. Well, why is a leave effective? A leave stops your body from making inflammation. It's called a COX-1 and COX-2 inhibitor. So if you stop your body's ability to make inflammation, you're going to have subjective pain relief. But the tissue damage still exists. So if you get an injection or you take a pain medication that doesn't allow your body to feel the pain or discomfort that you're actually in, what do you think happens down the road? You're doing more, you're bending, twisting, lifting, standing, walking, and all of a sudden one day that medication wears off and it needs to be stronger, or you need more injections. Your body is continuing to break down faster and faster, and we're simply masking the issue instead of addressing the person's needs.
Now, we have only got a couple of minutes left, but in the event that you're working with an individual to avoid surgery, are you prolonging the inevitable, or can it be a situation that maybe you don't need surgery eventually?
You don't need surgery eventually. 9 out of 10 patients who are recommended surgical intervention, especially for neck or back pain, are not patients that actually need surgery at that time. The truth of the matter is this. The demographic of people we work with is a lot older, okay, 75, 80, 90 years old plus. I had a patient, Biagio, he's 86 years old, previous back surgery 25 years ago. Couldn't feel his legs or feet. I treated him for 3 months. His pain is gone. And but when I say gone, I mean gone. I just did his reevaluation 2 days ago. I haven't seen him in 30 days. After I finish a care plan, the patient leaves, comes in for an evaluation. When I did his functional outcome scores that he actually fills out himself, his back pain score is a 0. His neuropathy and nerve damage score is a 2, okay? So you're looking at somebody who's 86 years old with no quality of life and function when we met them, and he can now feel his legs and feet again, and he can do what he wants.
Doc, we really appreciate it. Dr. Christian Miliotto from Western New York Pain Relief. For more information and answers to your question, contact Western New York Pain Relief by calling 716-650-PAIN or go to WNYPainRelief.com. Sponsorship and promotional consideration for the preceding segment was provided by WNY Pain Relief. And don't forget to join me weekday morning 7 to 9 a.m. on The Big Weck.